it is 6:03, or if you're in the West Coast like myself, it's 3:03 p.m. Welcome to today's webinar, Arthritis Myth Busting. I would like to first thank today's sponsors, Boehringer Ingelheim, Amgen, AbbVie, and 1MD Nutrition. My name is Eileen Davidson, or as you may know me online as Chronic Eileen, and I'm really excited for today's webinar. But first, let's do some housekeeping. Just so you all know, everybody has been muted. Please use the Q&A function at the bottom of the screen to type questions. It is not a chat, unfortunately. It is just for questions. There will be short presentations followed by discussion, ending with the Q&A from the audience. There will also be a post-event survey, and you can also find this on YouTube and on their website or under webinars. So let's first start off with a poll. Yeah, I'm pretty sure these are all things that we've heard in our experiences of living with arthritis. Let me give it just a couple more moments to see what is the most common myth. Numbers are so share. Okay, so I think all of the above is the most common, other than arthritis is only for older adults. I know when I was diagnosed with rheumatoid arthritis at 29, I was very confused because I was diagnosed with arthritis before I had any wrinkles or gray hair. And I didn't know that was even possible. Sorry about that. And today's guest with us is myself. I'm an arthritis advocate. I'm living in Vancouver, BC, Canada, adding, I guess, a slight little international flair today. I do some public speaking and writing. You may see my words on creaky joints. And I am a partner in research. I'm on the Arthritis Research Canada Patient Advisory Board and kind of floating around in other areas as well with advocacy. I'm really excited to be here today, as well as these two amazing rheumatologists, Dr. Adam Kreitenberg and Diana Gurnita. Sorry, I couldn't see your name for a second. I'll let them do a little bit more of an introduction to themselves as we go along, because they are probably better at talking about themselves than I am. But first, we'll move on. There seems to be a slight little lag when I push a button. It likes to go twice. Maybe I'm a little too excited with the keyboard. All right, so our learning objectives today are identifying and debunking common misconceptions around arthritis. There's so many of them that we can have a whole webinar on it. And we're going to learn the benefits of exercise for managing pain, stiffness, and joint function in arthritis. I know that I went and I did my workout this morning, followed by the sauna, and I'm feeling pretty good after that. And we're going to talk about developing strategies to address personal biases about arthritis and how to advocate for yourself in a healthcare setting. Now I'm going to pass it off to Dr. Adam Kreitenberg.
Hello, everybody. Thank you so much, Eileen, for the kind introduction. A little bit about myself. I'm Dr. Adam Kreitenberg. I'm in Los Angeles, or a suburb of Los Angeles, California, called Tarzana. That's where my office is, and I'm working in private practice. I want to thank the Arthritis Foundation for putting on this webinar, because really the Arthritis Foundation has been super instrumental in helping us providers and helping patients basically survive in what is that dangerous web of arthritic conditions. They do so much for us with regard to advocacy, support, research. I mean, really, they're doing everything that they can, and it really shows at the end of the day with the successes that they've allowed for. A little bit more about myself. One of the reasons why I became a rheumatologist is because my mother has psoriatic arthritis. She was actually diagnosed before I was born, and it definitely had an impact on me growing up with somebody who was suffering from chronic arthritis. Unfortunately, at the time she was diagnosed, they didn't really have very good treatments. Finally, biologic medications became available, and she has been able to live a normal life for the most part. And it's been a miraculous recovery for her. But still, because of all those years where she was inadequately treated, she is left with deformities and disability in her hands and her feet, and she struggles with daily pain as a result of that. So we're going to be talking today about diagnosis and treatment myths. Can you do the next slide? Thank you. Oh, all right. So myth number one, and some of these will be true and some of these will be false. But myth number one is arthritis only affects older adults. Well, we know that that's not entirely true. Well, yes, older adults definitely have a predisposition for developing arthritis, but there's definitely a large number of people who we see who are not older and yet still have arthritis. And so osteoarthritis is on one side that skews kind of older people, and then skewing the other side is the more autoimmune types of arthritis. And so if we're looking at sort of the image over here, we see rheumatoid arthritis, and we see juvenile idiopathic arthritis, and psoriatic arthritis, lupus, osteoarthritis, and gout. And so, osteoarthritis, as we mentioned, tends to be older people, but younger people tend to have the more autoimmune conditions. It can be as early as in your 20s, as with you, Eileen, 30s, 40s, and 50s. And then even in the case of juvenile arthritis, as it says, juvenile in the name, we're talking about people who are typically diagnosed and suffering under the age of 16. In general, about 20% of 18 years and older will have some sort of arthritis, but it's always important to differentiate what type of arthritis. And when people come to my office, they always ask, well, I am having joint pain. What type of arthritis do I have? And that's why seeing the provider, getting an early diagnosis, and then putting on an appropriate treatment plan is of the utmost importance. Moving forward.
Yeah, I know that this has a little spot where I'm supposed to kind of
Of course.
my diagnosis. And I started symptoms around 24, and it was because I was that age. Nobody was really taking my pain serious. They were just kind of brushing it off to lifestyle or the job that I was working as an esthetician. And it took me over 5 years to get a diagnosis. And that was until I was pretty much ready for being put on long-term disability. And I could no longer do my job as an esthetician. And it was myself that had to do the research, find out why I was experiencing this pain, and ask my family physician at that time for a rheumatoid arthritis test. And she even said to me, she goes, I think you're a little bit young for rheumatoid arthritis. But 3 weeks later, I was diagnosed. So there's a lot of misconceptions about who gets arthritis, even in the healthcare world. And I've known people who've been diagnosed, as a baby when they're living with arthritis. So it's definitely not for just the elderly.
And that is so important because not necessarily everybody has the appropriate access to care that they can get. And even if you do have access to care, there may not be appropriate education for those providers that you're seeing. So it really, really is important to seek out if you have a problem, you can only be your best advocate, as was the case for yourself. And you seek out the right person to see, and hopefully they can get you the right diagnosis at the right time. So we're going to move on to myth number 2. Arthritis is just a natural part of aging. That is false. Okay, so yes, arthritis is a natural part of aging, but it's not the only part of aging. It looks like we're skipping a little bit too fast. Perfect. So not everybody will develop arthritis, but there definitely is a tendency for people who are older to have arthritis. But there's so many factors besides age that play a part in development of arthritis. So genetics is important. So I have a lot of patients who come to me and say, look what my hands are doing. They're becoming deformed. They look just like my mom's hands. They look just like my grandmother's hands. Well, that kind of suggests that there may be a genetic component to what this person is experiencing. We know that there's a genetic component in osteoarthritis, but there also is a genetic component in certain types of autoimmune arthritis as well. Lifestyle not only plays a part in whether you develop arthritis, but also how symptomatic you're going to be. So there's certain things that can predispose somebody to early arthritis, like we talked about, genetics, but things that you do in your lifestyle, such as smoking, can create inflammation in the body. Obesity can create inflammation in the body, but also put extra stress on the joints. Overuse activities, even certain types of athletics. And then physical inactivity. Now, one would think that physical inactivity shouldn't necessarily cause arthritis. But if you think about it, if somebody is inactive, they potentially will be gaining weight. They will have actually muscle atrophy, and you're actually putting more stress and more pressure on those joints, which could potentially lead somebody to developing early arthritis. Injuries are an important source of arthritis. So this may happen in more athletic people, but doesn't have to be athletic people. An older person can have a fall on their knee, fall on their shoulder, develop a tear. And that not only the injury itself can cause structural damage and then accelerate the onset of arthritis, but even having the surgery to potentially fix that tear may increase the risk for a progressive arthritis as well. And then there's other health conditions. And some of us as rheumatologists, our bread and butter is taking care of autoimmune diseases. And autoimmune diseases involve the immune system. And the immune system is normally there to keep you safe in your environment, help fight off infections. But when they're not working properly, it creates inflammation targeted at your joints, and that can cause pain, swelling, stiffness. And then if that goes inadequately treated, those people are at risk for developing disabling arthritis, deformities, joint damage, and all of the above. All right, next slide. So myth number 3, and this is one of my true myths. arthritis is not just a wear and tear of the joints. Okay, again, parts of this may be true that there can be a wear and tear component to joint arthritis, especially osteoarthritis. Now, classically, it was always thought that osteoarthritis was a mechanical sort of wear and tear arthritis, but that may not necessarily be the case. What we're learning more and more is that there may actually be an inflammatory component to this. People have done studies on joints, and they found actually elevated levels of inflammatory cytokines or inflammatory mediators present in the joints, so that not only, which can cause excess pain in the joint that otherwise wouldn't be there, can cause excess swelling in the joint, and even deterioration of the joint in a more accelerated way. So that's more of like the osteoarthritis, again, which is not just wear and tear, but if you're looking at the other side of the spectrum, something like rheumatoid arthritis or an autoimmune arthritis, there's definitely not a wear and tear component to that. Okay, we're talking about, again, inflammation targeted at the joints causes pain, causes swelling, causes stiffness. And if that goes inadequately treated, so again, so there's two facets of treatment, really. We want to treat to help somebody feel better, become more functional, improve their quality of life. But if that goes inadequately treated, we're talking about developing joint damage, cartilage damage, damage to the joints, damage to the bones. That's going to lead to deformities and then eventually disability. So yes, wear and tear can always be a part of the development of arthritis, but it really depends on the subtype of arthritis that we're talking about. And many of our patients, although they think that this is just a wear and tear, and the truth is, most doctors also think that osteoarthritis is only a wear and tear diagnosis. And in some respects, when you want to describe it in layman's terms, that's what most people do, to create a dichotomy compared to the autoimmune arthritis. But really, there's many different factors that are involved in the progression of arthritis, and it's way beyond physical use and wear and tear. So we're going to take a little tangent here. This is not a myth, but this is actually a little bit of disease education. We're going to be talking about psoriatic arthritis, or the monomer PSA. Okay, and psoriatic arthritis is near and dear to my heart because, as I mentioned before, my mother has psoriatic arthritis and she suffers from psoriatic arthritis. And the development of medications and the sort of the progression of medications that she went through have been miraculous for her. Again, she still lives in chronic pain, but psoriatic arthritis is not necessarily on everybody's view. When you see a doctor, and you come with arthritis symptoms, you can ask them to check, well, what are the blood tests that I can check to see if I have autoimmune arthritis? Well, believe it or not, rheumatoid arthritis does have blood tests, but psoriatic arthritis does not have blood tests. And it's purely a clinical diagnosis and may take the expertise of a rheumatologist to diagnose this. In general, most people develop the skin portion of the disease first, and about 30% of people with skin psoriasis will go on to develop the autoimmune arthritis, which is psoriatic arthritis. In general, people usually develop it between the ages of 30 to 50. It could be male or female, but the bottom line is that it's actually affecting multiple areas of the body. Psoriatic arthritis can affect the joints, it can affect the tendons, it can affect your spine, and it can affect your skin and your nails as well. So bottom line is, early detection is the most important, because untreated psoriatic arthritis can lead to disfiguring skin disease and as well as disfiguring joint disease as well. Next slide. Gout. So it's my understanding that our next speaker is actually far expert in gout. So she can go into that even a little bit further. But most of us rheumatologists know quite a bit about gout. And gout, believe it or not, it was considered to be like a rich person's disease. And why is that the case? Is because the only people that could afford to eat purine-rich foods were people who were wealthy. Okay, so things like alcohol, things like red meat, things like shellfish, those can be definitely problematic in somebody who has gout. But it's not just the big toe that can be involved. Multiple joints can be involved. And typically, there's definitely different facets of treatment. A lot of people, they'll get their first gout flare, they'll go to the urgent care, and they'll get it treated, and then it comes back again, and back again, and back again. So there's really things that we have to consider when somebody has gout. Not only is lifestyle management a huge portion of what we're supposed to do for gout, including diet and weight loss and weight management, but we need to treat the acute flares, and we actually have medications nowadays also to help prevent the recurrent flare. And we know that that's potentially even more important than treating the active flare that the patient's having then. Next slide. Myth number 4, there is no cure for arthritis. That's also a true statement. What I love about this is, there's that phrase, an ounce of prevention is worth a pound of cure. That's what's so important about this. Well, yes, most of our arthritic conditions do not have an actual cure, but we definitely have ways to help prevent or delay the onset of arthritis or delay the progression of arthritis. And there's multiple different things that we can go through, lifestyle interventions that I think that our next speaker is going to go into that a little bit deeper. But the Arthritis Foundation has been invaluable in helping support us as providers and as patients as well in research, science, advocacy, support groups, education. Without the help of sometimes the Arthritis Foundation does the dirty work for me. I have a patient who comes in and they have a new diagnosis, so they don't really have a clear understanding of what their diagnosis is. I have a certain amount of time with patients and I can go through many of the details, but having the tool of the Arthritis Foundation that I can connect my patients with has become invaluable and helped my patients and me develop a better relationship with the patient and better long-term success in treating that patient's arthritic symptoms. Next slide. All right. And the last myth that I'm going to be talking about is there are no effective treatments for arthritis. Again, we talked about cures, that there are no cures, but there definitely are effective treatments for arthritis, okay? There's been significant advancements in science that have led to this, and not only treat the signs and symptoms, but actually prevent the progression of many of these diseases. Now, if we're looking at the far left of the slide, we're talking about NSAIDs or non-steroidal anti-inflammatory drugs. Those are kind of things that you can get over the counter. There are prescription medications as well, but those are kind of non-specific, non-targeted anti-inflammatory and pain medications. And for the most part, any of these medications that we're going to be talking about here, it's important to discuss with your provider to see whether they are appropriate for you and your case of arthritis. Corticosteroids. Now, when we think of steroids, people get very upset. People get, red flags come up. We as rheumatologists, we use steroids, but the goal of steroids is to prevent toxicity. We know that they work and they work well. So you want to keep the lowest necessary dose for the shortest period of time. Okay. And those can be administered as an injection. Those can be administered orally or as IV. So again, there's a wide range of ways that we can use steroids, but again, your provider needs to pick and choose when they're necessary as to prevent long-term consequences of being on steroids. So conventional DMARDs. So DMARDs stands for disease-modifying anti-rheumatic drugs, okay? And there's many medications that fit this category. So we think of hydroxychloroquine, methotrexate, leflunomide. These are some of the medications that we use for our autoimmune conditions. Now, conventional disease-modifying medications are typically not used in cases of osteoarthritis, but more cases of the autoimmune or inflammatory types of arthritis. Now, we're able to achieve certain levels of control of autoimmune conditions with these disease-modifying medications, but frequently patients will progress or their disease will not be adequately treated. And we need to use more targeted and a little bit stronger treatments. And that's where the biologic disease-modifying anti-rheumatic drugs come into play. They've been probably around for maybe 20 years or more. And speaking from personal experience, not only have my patients benefited from this, but my mom, it was a miraculous response for her once she got on biologic medications. And she's been on biologic medications for more than 20 years now. And again, she's been able to live a somewhat normal life as a result of that. Now, again, these are targeted treatments. Science has been able to delineate many of the factors that are involved with certain types of autoimmune arthritis, and we're able to target certain pro-inflammatory mediators and downregulate the inflammation as a result of blocking these mediators, which helps to treat disease and help prevent long-term problems and progression of that disease as well. Next slide. Oh, actually, you know what, Eileen, why don't you join us on this?
Yeah, I have a little thing to say, and my best advice to other patients is to understand, and I call this the arthritic rule of thumb. What works for one may not work for another. Although the advances in medicine have been, over the last 20 years, have been great. I have an aunt had an aunt who was diagnosed with rheumatoid arthritis good 40 years prior to me. She was in a wheelchair. I barely ever saw her walk. She was in a lot of pain. She had the deformed hands. And she actually passed away the same week I was diagnosed from a heart attack, which is a common comorbidity with rheumatoid arthritis. But however, now they aren't seeing as many people in wheelchairs or with the deformed hands, and the comorbidities like heart diseases has been going down. And at first I was terrified of medications and what it was going to do to me, but the advances of medication have really given me a lot new hope.
Yeah, I mean, I think one thing that's important to also mention is that there's always side effects that come along with any medication. And when you're having a discussion with your doctor, it's important to know what are the potential side effects. But not only should you discuss the benefits of the treatment or the risks of being on the treatment, but you also need to discuss the risks of not being on any treatment. And I think in the case of your aunt, there maybe not have been adequate treatments in general for her to use. And so she accumulated a lot of inflammation and cardiovascular disease as a result. But again, I cannot stress enough to my patients who don't want to be on any medication that this ongoing inflammation can increase your risk for having cardiovascular event. And being on medications not only suppresses the inflammation in your joints, but it suppresses systemic inflammation and prevents other comorbidities as well.
Yeah, and it just shows you that arthritis is so much more than just joint pain.
Absolutely. So this is another little bit of a tangent, and some of the audience here will be familiar with this concept and some will not. But we're going to be talking about biosimilar medications, and this is kind of like a high level understanding of what's going on in medicine. So we talked about biologic DMARD medications, and they've been out for a number of years, more than 20 years now. But in efforts to reduce the cost to patients, in efforts to increase access to patients, in efforts to decrease the utilization of healthcare dollars in general, the FDA and other governmental groups have allowed companies to develop biosimilar medications. And biosimilar medications are highly similar medications or almost copies of existing patented medications that have basically gone off certain levels of their patent. And what's happened is these companies come along and they do rigorous efficacy and safety studies to ensure that these medications are highly similar and nearly identical copies of the originator product, and are being utilized to treat our autoimmune patients. But not only autoimmune patients, actually they've been utilized, I think, first in cancer patients. So this is kind of potentially the future of rheumatology, whether us as providers or patients like it or not. It's a highly discussed topic recently. If you are going to be getting a biologic medication, you should understand from your provider whether it is the originator product or if it's a biosimilar, and discuss that with your provider to see whether they're appropriate for you. Next slide.
Okay, so we aren't quite done with you. We're going to ask you brain thoughts on supplements, what to say to a doctor if I think I have arthritis, and any advice for newly diagnosed patients.
Yeah, these are super, super important things to bring up. So I'm a huge proponent of supplements. I think that not everybody needs to be on supplements, but a lot of people would do well either with arthritis or to prevent the progression of their arthritis. Now, there's a couple of things that I'd like to focus on when I'm talking about supplements in joint disease. Number one, there's so many different supplements out there. How do you know which ones to use and which ones not to use? So number one that I always recommend is that there's a stamp for good manufacturing practices on the back of that supplement. Number two, you want to make sure that these supplements are third-party tested, because you want to make sure that there's the adequate dosing of that medication and that the dosing of the medication is adequate for what we're actually trying to achieve. Now, when it comes to joint supplements, I usually recommend things like that are anti-inflammatory, things like boswellia, things like curcumin or turmeric, things that have antioxidant properties as well, omegas, astaxanthin, as well as things like collagen, which can help with amino acids and the building blocks of many of the structures that are involving around the joint. Now, what do you do if you think you have arthritis? Well, Eileen, you did it, and unfortunately, our healthcare system failed to a certain degree. But if you think that you have arthritis, you need to go to a doctor and you need to tell them all of your symptoms that you're having. Now, this doctor may not be a rheumatologist, and so it depends what kind of access to care. Some people don't need to see their primary care doctor before they see a rheumatologist. But if you do, you can say, I saw Dr. Kreitenberg on an arthritis foundation, and he thinks that I might, need to do this. You need to be your best advocate, and you need to say the right things and ask the right questions. Talk about, are you having pain? Are you having swelling? Are you having stiffness in your joints? What makes it better? What makes it worse? Is there certain times of day when the pain is better or the stiffness is worse? You kind of need to go through all of those things, and that could help give the doctor an idea of, hey, listen, I'm invested in how I'm doing. Can you please send me in the right direction so that we can get the answers in a reasonable time? And then what do I recommend for newly diagnosed patients? I can't stress enough that people need to take notes and oftentimes bring a family member with you. I can't tell you how many times somebody comes to the visit after having had a long discussion about their new diagnosis and they don't remember a thing. It's shocking to have a new diagnosis. I think you can attest to that. It's shocking when you get it. There's a tremendous amount of information that is given to you. And what do you do with that information? A lot of times it goes one ear and then out the other. So take notes. Come back with more questions and have an advocate for you there who can remember and write things down so that you'll you'll be able to remember everything that was discussed. Because again, many of the arthritic conditions that we're talking about here are not curable conditions. You're going to have it chronically, and you're going to have to develop a strong relationship with the doctor, but you have to develop a strong relationship with your disease, with your condition. And so that's usually my first recommendation for people who are newly diagnosed.
I highly recommend the bringing a notepad and also asking your physician to go over things if you're lost on what they're saying, or being diagnosed with a chronic illness is terrifying. So it's okay if one thing goes out the other ear. Anxiety makes you flustered. So have things written down, ask your physician to write things down, ask for clarification. And yeah, definitely keep note of your symptoms. I find that to be one of the most beneficial things for my arthritis. And here I am 10 years later after my diagnosis, I still do it.
Amazing. Amazing. Thank you.
My computer is very sensitive, so I just have to touch it slightly and it goes. All right, so thank you so much for your excellent talk, Dr. Kreitenberg. You're a great speaker, and we'll have more for you in a bit, but we're going to move the stage over to Dr. Granita about diet, posture, and I'm just going to make sure that mine's really good while I say that, and surgery myths.
Absolutely. It's a pleasure to be here. My name is Diana Granita. I'm a rheumatologist for about 10 years, and my practice is based very close to Dr. Kreitenberg in Irvine, California. But actually, my practice is called Rheumatologist on Call. We see patients in multiple states in the United States. And, not only that I am a physician, but I also had a PhD in immunology. And when I discovered rheumatology about 14 years ago, I fall in love with it, and I never regretted this choice of becoming a rheumatologist. I was actually a cardiologist. My story starts with a cardiology training. I'm originally from Romania. I came here at Harvard University to learn and to do research. And later on, after I completed my PhD, I fall in love with rheumatology. And here I am many years after doing the same thing and enjoying it every single day. I would like to thank the Arthritis Foundation for such a wonderful opportunity that is giving to patients for the years of education and involvement in patient education, but not only that, supporting the physicians all over the United States and outside, and also supporting patients because, patients with arthritis, they need the support, and we will talk about that. And I'm proud to say that I collaborate with the National Arthritis Foundation for the last 10 years. So next slide, please. So we're going to continue this journey of talking about different myths that are out there for the patients with arthritis. And this is a topic that I have learned about a lot in the last 10 years. First, I learned from my patients, and then I learned by doing research. And just recently, the American College of Rheumatology finally released some guidelines for rheumatoid arthritis that were very welcomed by us as rheumatologists. And this myth that is talking that certain foods can cure arthritis, this is false, definitely false. Certain foods cannot cure arthritis, but it will help you. And if you are a patient with arthritis, especially with an inflammatory type of arthritis like psoriatic arthritis or rheumatoid arthritis, and especially if you are a patient with gout, you know that your diet is impacting the way that you feel. How many times have you been to a restaurant, you indulge in a good meal, and then you had a big dessert in the end, and then the next day you couldn't move, or you had difficulties to get out of bed, you had a lot of stiffness, you had your joints swollen, and you felt miserable. This is the story that a lot of my patients will tell me, and I believe them. Initially, I thought that this is anecdotal, but then I started to research it. And indeed, there are studies out there, and there are many studies that will show that certain foods will be beneficial, while other foods will be very, very bad for patients with arthritis. And I'm going to talk to you a little bit about those foods because I know there is a huge interest out there. And unfortunately, if you look up the internet, you're going to leave confused about different diets. And I want to take that notion of diet out of your head, because there is no diet that will cure arthritis. It's either rheumatoid or psoriatic or gout, but the diet or the foods, the nutrition, I would say nutrition is going to impact how you feel with arthritis. And let's talk about a little bit of the things that will be beneficial for you, because I know many of my patients will ask me, so what should I eat, Dr. Gurnita? And I'm going to tell you, there are 10 foods or 10 categories that I will press on, and you can combine those into your nutrition plan to make it feasible for you, because whatever somebody from one culture would like to eat might not be applicable to you. So let's dive a little bit in. So number one is whole grains. I stress this importance of whole grains like quinoa, brown rice, gluten-free oats, because they are full of fiber. And if you didn't know, if you eat more fiber, your gut microbacteria will be very happy. And because of that, will liberate certain substances that we call short-chain fatty acids, and those will decrease the inflammation in your body. Along with whole grains, you should consider to eat a lot of legumes like beans, lentils, or chickpeas, because again, like whole grains, will also bring you protein and fiber along with other minerals or vitamins, and they will also not only make you feel better, but will also reduce your cardiovascular risk. As Dr. Grittenberg said, because you have ongoing inflammation, your cardiovascular risk will be increased. And what you need to do, and it's actually recommended by the American College of Cardiology, to eat more legumes and to incorporate them into your diet. The next category is vegetables. The greener they are, the better it is. Things like spinach, kale, or broccoli, and others will be very, very healthy. And again, will bring you a lot of fibers, will give you, or will bring you vitamins, minerals, polyphenols that will also fight inflammation in your body. Another category that is one of my favorite ones is to eat fruits. And here, I would like to stress the fact that there are certain fruits like berries, blueberries, strawberries, blackberries, that they do decrease inflammation. And there are studies, especially in patients with rheumatoid arthritis, that show that those people that eat more berries will actually have less inflammation, and their markers of inflammation will also decrease. Along with berries, papaya or mango, those are enzymatic fruits, and they also help you with arthritis. Now we'll move next to another category of foods like omega-3 fatty acids. And you can find omega-3 fatty acids in salmon, in sardines, all kinds of fishes. But if you don't like fish, like some of my patients, they say, Dr. Gurnita, I don't like to eat fish, then it's okay to take a supplement. And like Dr. Klittenberg said, I'm a proponent of supplements, but I will propose those supplements that are supported by science. And the use of omega-3 is actually supported by science. It was shown to decrease inflammation. And there are studies that will also show that omega-3 fatty acids will be comparable in effect with non-steroidal anti-inflammatory medications, or with ibuprofen or naproxen. So that's why a supplement with omega-3 fatty acid, it is okay to be used in those people that don't like to eat fish. Another category of foods that I think is beneficial to incorporate are the fermented foods. And these are natural probiotics. And here I would include yogurt, kefir, sauerkraut, and those probiotics being natural, and you don't have to take another pill, will also help the gut bacteria. So that's why helping your gut bacteria, we have more and more research that are showing that it's instrumental in controlling the general inflammation in your body. Another category of foods are the nuts and the seeds. If you're not allergic to nuts, I know here in the United States, there are many people that are allergic to nuts. You should eat at least a handful of nuts, and you should combine them. walnuts, almonds, pistachios, whatever you like, you should include them into your nutrition plan. The same with chia seeds or flax seeds, you should incorporate that. I do like to mention olive oil. You know, if you like salads, just put a little bit of olive oil and little bit of vinegar, and stay away from all those already done sauces that are available to buy in the grocery stores. And the last category of things that I want to press on are the spices. You know, instead of putting more salt onto your food to give it a flavor, you should incorporate turmeric, which, you know, Dr. Krittenberg said contains curcumin, which is the active substance of turmeric. That will decrease inflammation. You should incorporate more garlic or ginger. These things will not only improve the flavor of your food, but will also have the power to decrease inflammation. So with that, let's move to the next slide.
Yeah, I just wanted to add two little things quickly about diet. Somebody living with rheumatoid arthritis, it's not just in my joints that I feel when I eat bad. It's an increase in fatigue, an increase in anxiety and poor mental health. My sleep gets worse. My stomach, maybe I don't need to rush to the bathroom, but I feel queasy, or my concentration is off. My cognitive function or brain fog increases. So you really have to listen to your body about how food makes you feel when you live with any inflammation, really. And just to name drop a little bit, but I was part of those ACI guidelines.
Absolutely. I love that. You know, in 2023, when the guidelines were released, we were very excited that finally the American College of Rheumatology recognized the role of lifestyle or modified lifestyle in the life of patients with rheumatoid arthritis. We do have some very soft recommendations for patients with gout. However, the guidelines for patients with gout they do not emphasize the importance of nutrition, but our patients will tell us that eating certain things, like you said, Eileen, will impact them, not only their mental health, they will feel, they will feel the brain fog, they will feel very, very tired, as you said. So the effect of inflammation is not only in the joints, but it is a systemic form of inflammation. And this is something that I would like to press and people to know, that rheumatoid arthritis is not only inflammation in the joints. Gout is not only the big toe pain. Psoriatic arthritis is not only the psoriasis of the skin. We are talking about systemic inflammation that will affect many other organs, from the eyes to the lungs to the heart to the kidney. So that's why it's important to control inflammation to the next level, not only to the joints. Now we're going to move to this myth that maintaining a healthy weight can help combat many side effects of arthritis. 100%. Actually, there are many studies that will show that not only the weight, the extra weight, will put more pressure to the joints, will deteriorate them faster, but also the extra fatty tissue. Actually, the fatty tissue that is there will produce certain proteins that we call cytokines, and these proteins will increase inflammation. And there are also studies that will show that patients that are overweight or obese, they will have more or will increase the risk to develop rheumatoid arthritis. They will increase the risk to develop psoriasis and further on psoriatic arthritis. Obesity is also very much linked to other metabolic diseases like high blood pressure, high cholesterol, and coronary artery disease, but also with gout. So obesity, or the fact that you have the extra weight, is not only the cause of your deterioration, but it is a problem that will generate inflammation in the whole body. Next. So this is another topic that I discuss with my patients all the time. You know, patients that are in pain, they are afraid to exercise. And many of them, they have this feeling that if they exercise will make the arthritis worse. But actually, this is not true. And I want to congratulate the Arthritis Foundation for running the campaigns to walk with a dog or going outside or walking or organizing the marathons, because this is very important for patients with arthritis. Now I'm going to tell you a story of my patient. When he came to me, he was barely able to move. He started treatment, he felt better, and after he felt better, he started to incorporate all the lifestyle changes that we are talking here, from nutrition to exercise to, even mindfulness. And after a while, after a couple of years, I would say, he started to run marathons. And during the last visit, he told me that he went up to Kilimanjaro and he was able to complete this task. How wonderful is that? So once again, don't be afraid to exercise. You don't have to run the marathon from the very first time. You just have to start with low types of exercise, things that will be comfortable for you. And if you cannot, walk, maybe you go in a pool. I strongly encourage my patients to go in the pool, because in the pool or in a pool with a little bit warmer water, your muscle will relax and your body will feel better. And just the fact that you walk in the pool, you don't have to run, you don't have to swim, just be there, just try to do any exercises that you feel comfortable, because physical exercises, it's proven to reduce the pain, to improve the function, and actually keep the function of your joints. And not only that, but physical exercise, you might know, that will improve your life expectancy. It will improve your mood, and it will decrease your cardiovascular risk. So there are so many benefits that physical exercise will have for patients with arthritis. And as you can see here, you can pick whatever is comfortable or whatever you like, from water aerobics to yoga to tai chi to doing Pilates to doing, let's say, tennis or dance. Do something that you like, but do it consistently.
For myself, I have arthritis in my feet, my ankles, and my knees. So walking can actually sometimes aggravate it, especially if I'm flaring. So I have a treadmill in my living room, which is great. I will use it, but not when I'm in pain. That's when I go for the elliptical. And I find the elliptical to be a great exercise because it doesn't give me the pain that has as much impact on my feet. And then I'll go to the sauna after. So that's my little thing to get me exercising, is do the elliptical because I feel good after. I'm not going to trigger pain, and then reward myself with a little bit of sauna after.
I love the fact that you mentioned sauna, because I do recommend that to many of my patients. It's especially infrared sauna or any type of sauna, it will relax your muscles, because if your muscles are relaxed, your nerves are not triggered and firing all the time, and they will not send the pain signals to your brain. So that's why I'm a strong proponent of sauna.
I'm a huge fan of the sauna. It's my absolute favorite thing.
Sure. And this is another myth that I discuss very often with patients. When they come to me and they get the diagnosis, they go on the internet and they will find out that some patients will get to surgery. And actually, if you are someone with rheumatoid arthritis, psoriatic arthritis, gout, that you are diagnosed in the early stages of the disease, and that's very important to find, like you, Eileen, you were able to advocate for yourself, you found the doctor, you found the diagnosis. If you are in that situation, that you are going to know what you have and you are in the early stages of the disease, and if you control your lifestyle, if you control your weight, if you do some exercise, if you associate these changes in your lifestyle with the proper medication, with the proper help from your provider, I don't think you will get to surgery. There is rare situations and very late in life when you can, you need surgery. And there are people without psoriatic arthritis or rheumatoid arthritis that will get eventually to surgery, like knee replacements or hip replacement. But again, surgery, you can avoid that. With the proper treatment, with the proper choices, you can avoid surgery. And this is one of the myths that I love because, I do see a lot of people going on the internet. So when you find out that you have a disease, it's absolutely normal to go on Google. Who doesn't do that? I do that. I'm sure you can do that. So it's important to understand that Dr. Google doesn't have a medical degree. So if it's on the internet, is not always true. Actually, what I have done, seeing a lot of misinformation on many channels, from Instagram to YouTube to you name it, Facebook, all these social media platforms where many of us we spend too much time. We do find information and we do find people that they claim they cure diseases. They claim they cure gout. They claim they cure rheumatoid arthritis. And at the end of the day, they want to sell you something, a product. So in an effort to educate patients, I have started a YouTube channel that carries my name, the name of the company that I have, Rheumatologists on Call, where I have try to debunk all these myths. And I try to give scientific information. Like Dr. Krittenberg talked about supplements. That's what I talk about. There are certain things that are scientifically proven to work. There are certain things about nutrition that are scientifically proven to work. So that's why I started this channel, to educate people, to bring them on the right side of the coin. Because a lot of times I would see people getting their information from sources that are not very credible. So I would like you to check, if you look on an article, look at that article with critical eyes, I would say. Think about who wrote the article and what kind of information is presented there. Are they trying to sell you something? Is it from a trusted doctor? Is it from a trusted source, like a hospital, like a big hospital? I mean, you should rather believe information presented by Mayo Clinic, for example, or Cleveland Clinic, like big resources that will give you important information. And don't forget about the Arthritis Foundation, because the Arthritis Foundation gives you a lot of information, because it's so important to get that from resources that are trusted resources. All right, so another myth is that no one understands what I'm going through, and this is completely false. Why? Because you as a patient with a disease like rheumatoid arthritis, psoriatic arthritis, you should actually talk to other people. You should not be alone. You should research groups, or you should use the National Arthritis Foundation, because they have these local chapters where I'm sure you're not going to feel alone. You can share your story, and you can find out from other people sharing their stories, and you're going to understand that your challenges will not be only your challenges. There are other people that will go through the same challenges, and you can share that information. They can also teach you what works for them, because that can apply to you. You should also talk to your family, to your spouse, to your friends about how you feel, because there might be a situation where you cannot attend a certain event because you don't feel well, but they will be there to understand you. You should communicate your needs, or you should communicate how you feel to your close group of friends or your family. And then it's also important to create that kind of relationship with your medical team. Share with your doctor what are your questions, what are your concerns, and clarify those with your doctor, because he is there with the experience that they have to help you and to give you further guidance. And if you if you have days that you don't feel well, communicate even with your employer, because you have this right to take days off when you have a flare-up. And it is very important to understand that those flare-ups will come. We know, and I know from my patients, that there are certain times in your life, like stressful events in your life, that will bring a flare-up, or certain foods that will bring a flare-up, or the fact that you didn't sleep very well, and that will generate a flare-up. So those flare-ups, most of my patients will know when they come. And what I tell to them, if you feel like a flare-up is coming, intervene at that point. Take some time, rest, sleep more, try to do a massage, try to go to the sauna, try to eat the right things. All of these things, maybe it will not prevent the flare-up, but it will decrease the how aggressive that flare-up could be. Next.
All right, so we're going to pick your brain a little bit on a few things, and then we will be wrapping up asking the Q&A soon. We would love to know, what are some of your favorite anti-inflammatory meals? Is gout from being lazy? And any words of wisdom for patients actively in an arthritis flare?
All right. So I'll start from the end because I just touched about an arthritis flare-up. As I said, patients with inflammatory type of arthritis, and I will include here rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and even gout or pseudo gout, they will have these flare-ups from time to time. So those we cannot fully prevent, and we don't understand exactly what is causing them. But we know, as I said, that stress, poor sleep, nutrition, certain things like too much sugar, for example, or too much processed food can precipitate a flare-up. But also, if you get a virus, and I forgot to mention that, if you get a virus, if you get a vaccine, that can precipitate your immune system and you can develop a flare-up of rheumatoid arthritis, for example. Shouldn't you stay away from people? No. You should be more cautious? Yes. Shouldn't you not take vaccines? No. I'm someone that will propose to take the vaccines, the appropriate vaccines, because those vaccines will prevent complications for your disease later on. So those things can precipitate a flare-up, but what I will say is that if you intervene and if you call your doctor, maybe you need to use more anti-inflammatory medication during that flare-up, but incorporating the treatment plus incorporating these lifestyle changes that I mentioned, it will help decrease the extensive time that you're going to have that flare-up. It's going to shorten that flare-up and it's going to decrease the severity of that flare-up. So
right, the others talk. I have a flare agenda that I have. So I mark how long my flares are lasting for, and I write that down for my rheumatologist. I be proactive with ice, heat, gentle stretching, gentle movement, making sure I've been taking my medication, examining stress, my sleep. And you can develop this over time, seeing if you've done any triggers lately. And this will actually help you bring up your flares to your rheumatologist, because you can say, hey, my flare's been going on for 4 weeks. I've taken my meds. Nothing that I've done normally works. What's my blood work at? Is it time for a medication change? Do I have an infection? Anything like that. So have a flare action plan.
Absolutely. I love that. I actually designed, this is, I don't know if people can see, this is a rheumatoid arthritis journal that I give to my patients. I design it and I give it to my patients because it's so important to keep the track of your triggers, because knowing your triggers, you will know how to act around those triggers. Now, the next question that I have here is gout from being lazy? Absolutely not. No, gout is not from being lazy. Gout is actually a metabolic disease. Many patients, they will inherit that. It's a genetic kind of transmitted disease. And with certain lifestyle changes that you can have or over the course of years, you can increase the risk to develop gout. I am happy to share that I have a book about gout, what gout means, how to manage gout, everything that you have to know about gout, but also how to bridge gout with nutrition. And this book will be released on October 1st. It's available on Amazon for pre-sale. And I talk about all the science behind choosing certain foods but also all the science about using treatment. Because, I understand this approach of wanting to go only on natural ways or only on medication, but the reality is that if you bridge those two worlds, your success rate will be so much bigger.
And do you have any meals for us that you like?
Yes. I actually have a list of meal plans that I have collected over years, and I do share them with my patients with rheumatoid arthritis, and the book about gout also contains about 90 recipes that were designed based on the principles that are appropriate for patients with gout. But just to mention a few of my favorite ones, I do like to do that for my kids as well. I do a blueberry smoothie and I pour a little bit of turmeric in that. I love to do Mediterranean quinoa salad. I serve that all the time. I like to cook salmon with a little bit of garlic, with spinach, with brown rice. I personally like chia pudding with a lot of berries on top. I give it to my kids. They love it too. I like lentil soup. I like lentil with other vegetables. I love also to do bean soup, but my kids don't like it, but I do it from time to time. I like avocado and egg toast. I love that in the morning. I like grilled chicken. I like oatmeal with flax seeds. And, these are some of the things that I cook in the house in an effort to promote what I preach to my patients.
I eat a lot of the same things, and to make it easier on myself with fatigue and being a single mom, I do a lot of meal prepping. So I do 3 days in advance just to make sure I'm not getting bored of the food and the food stays fresh. So I eat a lot of what you've just said and meal prepping just a few days at a time so I don't have to do it every day. It's just perfect on those bad days.
Absolutely.
All right. So we've reached the end of our webinar. We're going to do a quick summary. And basically, what we've learned today is it's not just for old people, and it's not just an inevitable part of aging. Exercise does not worsen arthritis. In fact, actually, I firmly believe that if I don't exercise, my arthritis gets a lot worse. And diet can play a role in managing symptoms. It's not a cure, but it is definitely very important. And surgery isn't an automatic. I've been living with arthritis for about 15 years and I have not had surgery yet. It's just removing those bias and knowing that everybody's arthritis is their own arthritis and this is our journey. We're going to join now for the Q&A portion. Screen to get those. Oops.
All right, maybe I'll start. So one of the questions that we got was, what's the difference between a biosimilar versus a generic medication? That's actually a great question. We kind of touched very, very vaguely on the idea of biosimilars. But biosimilars are not generics. So a generic medication is a medication that is a small molecule, typically a pill. And the way that it differs from biosimilars is, number one, how they're made. So there's typically an active ingredient in a generic medication that is made chemically, synthesized chemically. It's put into a tablet with some other things to make it stable, or excipients we call them, and that makes the small molecule generic medication, which was based on a prior patented drug. Biosimilars are slightly different, but they're actually much more complex. So it's actually not a generic at all. It's actually a different branded medication that exists that is just highly similar. And instead of synthesizing chemically a specific ingredient, you're actually using biologic cells. You're actually using live biologic cells to produce these medications. And each batch is actually going to be slightly different because there's definitely variability in what cells actually pump out. And the way that they're approved is also different. The level of scrutiny that goes for a biosimilar FDA approval is much higher than that of generics. Let me actually just pick up one more other question. Are there any types of arthritis that are genetic related? So yeah, we kind of touched upon that a little bit. There's definitely types of arthritis that are genetically related. The most common type of arthritis that we see is osteoarthritis. Definitely has a genetic component to it. But as with regard to inflammatory types or autoimmune types of arthritis, we definitely see families with rheumatoid arthritis. We definitely see families with psoriatic arthritis. lupus, and then definitely ankylosing spondylitis. So ankylosing spondylitis, actually, when we're helping to diagnose it, there's actually a genetic marker that we can check to see whether that is seen, and that increases the likelihood of somebody having ankylosing spondylitis. And then finally, gout definitely has a genetic component to it with regard to how our patients metabolize the purines and the uric acid, and obviously could lead to, more things down the line.
Thank you. All right, Dr. Gernerte, we have one for you too. I'm just going to scroll up here. All right. What is the best kind of doctor to see if you have osteoarthritis, an orthopedic surgeon, or a rheumatologist?
I think that depending on the extent or how extensive this osteoarthritis is, if it's mild to moderate and it doesn't require surgery, you can still see a rheumatologist. We do have our ways to manage it. We can also give injections. We can also advise you or give you some anti-inflammatory medications when you need it, not chronically. I strongly advise my patients to use ibuprofen or naproxen for very short period of times for osteoarthritis because, like any medication, taking that in excess can lead to a lot of side effects. But when the osteoarthritis becomes severe, and there are some criteria to differentiate mild, moderate to severe, and your pain is continuous, then you should see an orthopedic surgeon because you might require to be evaluated for a replacement.
We have one more for you as well. Can you recognize a flare-up coming? And if so, is there anything I can do to stop or slow it down? Great question.
So I can tell you from my patients how they describe a flare-up coming. Most of them, they will tell me that they start feeling very fatigued. And they will have, dryness in the eyes, dryness in the mouth. They can have a little bit more stiffness that is coming on. And, there are patients that will say that in a couple of days, they have the full-blown flare-up, but there are also patients that will say that they wake up the next morning with a flare-up. So every patient is different. And what I will say is that you should write down, you should have that diary of your symptoms. And because of that diary, you will be able to recognize a flare-up much faster. And what should you do? I think I touched about that in the presentation, but take care of yourself. This is very important. It's all about you when you have a flare-up. I know you are probably parents, or you are like you, Eileen, you are a single mom, you need to take care of the others. But if you are not well, then you cannot take care of the others. So that's why I strongly recommend you to do things that will help you, like sleep more, eat the proper things, do meditation, or do anything that will bring your mind to peace. That will decrease the pain, but will also decrease the level of stress, because a flare-up will come also with a lot of stress. So trying to manage the stress level, the sleep, the food that you, and, call your doctor, and see if they can see you. Maybe you need an injection during that flare-up. Maybe you have a wrist that is very swollen. Maybe you need something from that doctor. And that's why, having that collaboration with the doctor is so important.
I totally agree. When I feel a flare, I go straight to drinking as much water as I can, doing gentle movements, the sauna, and also trying to target with food, because those are things that I actually have control of at that moment. All right. And we have another question. It's for me. How do I push through mentally on days when I am feeling defeated? That's a great question. There are times where arthritis can leave me feeling quite defeated. Fatigue gets in the way, cognitive function gets in the way. I feel bad about making a big mistake because I was foggy or something. Or I'm feeling lonely because I don't have the connections I used to have. So I say some of the best things that I've done for my mental health and living with arthritis is being an advocate, being involved in the community. I run an in-person support group, but I have to go to right after this. So my day is not done, but it's just connecting with others who get it, being able to help others, and just being there and letting people know that they're not alone. I also know that I'm not alone. And maybe adding some dark humor or some laughs over our situation. Humor is a great one. And then I'm also a firm believer in, like, if you're feeling negative emotions, to let yourself feel those. They're valid. They're not made up. They should not be invisible. Our diseases are often invisible, but what we're going through isn't really invisible. And so just letting yourself feel those, but then also try and focus on things that bring you joy, being creative, journaling, writing, painting, gardening, spending time with people that understand and that do not judge you, and just being productive in little ways, celebrating those small wins. So if I'm having a bad day and all I can really get done is some dishes and a little bit of gardening, then that's good. At least I tried. So yeah, I think that's a very important question. And it's just focusing on the now. All right. So I believe I just want to double check that's all the questions. Yeah. Okay. Just a reminder that the Arthritis Foundation has an absolutely great website. I, being Canadian, even go to it. There's so much information on there. The webinars are fantastic. I just watched one on cognitive dysfunction and fatigue, and it has actually helped me prepare me so much for a talk that I'm giving at the American College of Rheumatology conference later this year. So thank you for helping me in my presentation even. Yeah, there's the helpline and everything. So that's a great place to go to if you're seeking support. And they have upcoming events, which hopefully they invite me again to. These are great. I've known other advocates who've hosted them, great rheumatologists or care providers. So yeah, I think this is an absolutely wonderful resource that is being sponsored by today's sponsors and also put on by the Arthritis Foundation. And they are useful for you wherever you are in your arthritis journey. Sometimes you are new and you need information, or sometimes you've been living with it a long time and going through burnout and just need to come out of that burnout.
Thank you so much.
Thank you very much. It was a pleasure to be here.
Yeah, and I started following your YouTube channel. It is fantastic. I love resources like that. Thank you.
Thank you so much. I appreciate that.